Hello, hello, and welcome to today's podcast. Today, we are going to be talking about thyroid. We recently did a series on hormone systems, and thyroid got a lot of attention.
Yeah. Thyroid's one of those glands. It may be a small gland, but it is a mighty gland. It affects everything in our system. So it's certainly something that has a lot of controversy too, and there's a lot of misunderstanding about how it works and what to do with it and how to treat it and all. So we'll hopefully clear up a little bit of that. This is not an all-inclusive situation, but we're just trying to create more of an awareness and educate folks about really what it does.
And thyroid symptoms are one of those things that can often be, your labs will look normal because typically the labs that are tested is a TSH and a free T4, and those will look normal, even when other parts of thyroid don't look normal. So It's one of the things that can very often look normal and you're still feeling not normal.
Yeah. And, TSH plays a big part in how people get treated. It's certainly something that, the insurance requires an abnormal TSH before they'll allow or provide coverage medication wise for hypothyroidism. So that's certainly something that is the reason why TSH is kind of a big one.
Yeah. And because those labs don't always correlate, a lot of times things go undiagnosed or misdiagnosed. Yeah.
I mean, this we're talking about something that weighs half an ounce. This gland is so tiny. It sits right in the lower base of our neck, and it's a double-lobed gland. So there's one lobe on each side in our neck, and they're hooked together by a little bridge called isthmus. Little anatomy there. But this gland, this is why this dysfunction of thyroid just with us occurs and affects everything from midlife energy, weight, mood, metabolism, and even our hormones.
Yes.
But it doesn't work alone. So it's part of a larger hormonal orchestra, if you will. So it certainly talks and interconnects with the other hormones in our system too. But the thyroid is very important.
Yes. And it's definitely important to remember that so many of these systems are connected. The whole person is one big picture, and It all needs to be looked at. So basically, to put it simply, your thyroid is like a metabolic thermostat.
Yeah, I love that analogy. Metabolic thermostat telling your HVAC system, which is your body and your cells, how hot or how cold they need to be. And so that's kind of a good analogy that you can think of. So
energy production, body temperature, heart rate, digestion, brain function, that includes mental health, cholesterol, lipids, and menstrual cycles and fertility.
Yeah, it's incredible. It touches everything. And so it's as you can see that it just affects everything from that standpoint for people. So, but the conditions, we'll just kind of talk about the more common condition that people think of, which is hypothyroidism. So low thyroid function. There's a difference in diagnosis of low function versus hypothyroidism, as we talk about to our patients too. A person can have normal lab values, as we spoke of before, but they're maybe abnormally not optimal, or there may be some other issues, which we'll talk about too. But the low function is the reason why you maybe feel cold, tired, and fatigued. Whereas hypothyroidism is more of a insurance ICD-10 diagnosis that has to be reached from, a high TSH level. So, but you can think of that TSH is for just backing up a step. TSH is a hormone secreted from our brain, if you will, that sends out the signal, which is the TSH, to tell the thyroid to produce hormone. Then there's a cascade of events that happens to make the thyroid in its active form. So that's how we can diagnose hypothyroidism.
And some symptoms of hypothyroidism that show up even before you're technically clinically hypothyroid: fatigue, weight gain, cold intolerance, constipation, hair thinning, depression, brain fog, dry skin.
Yeah. So that affects a lot of stuff. And there's a lot of folks in midlife and beyond as well as younger individuals that have troubles with those things. And can it be thyroid? Yes, it can be. There's many things besides just their thyroid, but this is just certainly something that needs to be looked at, and, looking at hormone levels, thyroid hormone resistance, for instance, what we talk about is just like there's insulin resistance, there's also thyroid hormone resistance. And that's where basically the hormone may be in the normal range in our blood work, but the cells are not responding to it. So that's certainly something that can change and fluctuate. But, there's a lot of reasoning. There's a lot of different reasons why the cells just don't respond. Is there blocked receptors on a cell? Are there, what's the density? What's the receptor density look like? So, these things also be affected and driven by inflammation, inflammation, and specifically even insulin resistance, which is a significant form of inflammation too.
And stress, nutrient deficiencies. A lot of people are familiar with iodine and selenium and zinc as nutrients that can be deficient, that can affect the thyroid. Environmental toxins, just like they affect everything else in our body, can also affect thyroid and the way it functions in the system.
Yeah, and backing up just a touch here too, the nutrient deficiencies, even iron and vitamin D, as we'll talk about too, those are also something that directly affects, our thyroid production.
So the next thing that people are probably familiar with is the idea of Hashimoto's thyroiditis. This is an autoimmune condition where your body attacks your thyroid.
Correct. So there's a lot of theories and thoughts behind it, but essentially Hashimoto's thyroiditis is a form of hypothyroidism, hypofunctioning or hypothyroidism. Remember, there's two different options there. So at any rate, it's a low functioning thyroid that ensues essentially after that.
And the biomarker that you're looking for to identify Hashimoto's is a TPO or a TG. It's the thyroid antibodies.
Yeah, thyroid peroxidase antibodies. Those antibodies get formed. Your system will develop these antibodies to try to destroy its own thyroid. What those antibodies are doing is affecting the thyroid peroxidase protein. And so what will happen is that TPO is very important for us to create thyroid hormone. And if we're deficient in iron, or if we've got issues with our immune system, which leads to the autoimmune issues, then we don't make the thyroid hormone. And I would even, I don't know if there's any specific studies that I've seen, but I would even go so far as to say, well, what does the antibodies do to the receptors on the cells even? That's certainly something that I have a question about, but I haven't seen anything about that. So something I can look into.
One thing that's very frequently looked at with Hashimoto's or autoimmune thyroiditis is gluten. We've talked about it before. Gluten can be a very inflammatory thing that we take in. And very often, someone who has Hashimoto's, if they can remove gluten from their diet, they can see those inflammatory numbers start to come down and be in better control.
Yeah, the gut-associated lymphoid tissue is in our intestinal system, and that is over 70% of your immune system is located in your gut. And so when you throw something in there that creates such an inflammatory aspect, your body's going to react. And when it does that, well, it may be exaggerating your immune system, which could trigger the production of these antibodies and thus have an ensuing hypothyroidism. But it's the most common cause of hypothyroidism in the United States, hands down.
And you can have Hashimoto's without having a technical low thyroid, but it's something that you would want to be aware of and watch. It's one of those things where we have a patient who has Hashimoto's diagnosis and hasn't been followed regularly with her TPO. Like they're just testing TSH and T4, and TPO, watching how that fluctuates, can tell you, that gives you great feedback about what you're doing from a lifestyle perspective that is either helping or hurting.
Yeah. So you got to remember that, 5% of the population, it's got to be over 5% of the population actually has Hashimoto's.
But there's going to be a lot of people that aren't diagnosed.
And that's exactly where I was going. There are so many people that are not diagnosed because they are not getting the appropriate antibody levels checked.
Yes.
You know, we're going off of TSH levels or T4 levels. Well, you can have normal TSH, normal thyroid hormone levels, and still have significantly elevated antibody levels. And if you don't get the antibodies, then you don't realize what's going to happen, because eventually your thyroid will burn out and it will stop producing hormone. And that's what the antibodies do. It will destroy it. And that will be something that individuals can, if you catch it early, you might be able to reverse some of that. But it's certainly something that gets misdiagnosed and missed in general. And mainly women. Women they're 7 to 10 times more likely than men to have these types of things with Hashimoto's thyroiditis. Which I think is interesting.
I do think that's interesting too.
Makes
and
wonder,
again,
hormonal or is it
hormonal,
genetics?
Or is it also that more women are going down the path to get the test?
Right.
Because oftentimes, I think men just don't do that.
Right. But, 20 million, they estimate 20 million Americans have thyroid disease, which is kind of incredible. And majority of those don't even realize they have it. So looking at some of the thyroid dysfunction will the reason why it's important is because it increases your risk for cardiovascular disease and depression, infertility, even cognitive decline and metabolic syndrome. This is certainly something that if you don't catch thyroid disease, then you run these higher risks of developing these chronic diseases.
This is why it is so important to take these proactive steps to identify these things.
Right.
When you have a better handle on and can make changes easier. Obviously, once disease progresses, it's harder to reverse.
Yeah. And the thyroid is literally connected to just everything. And when I mean everything, estrogen, testosterone, progesterone, even, those influence and affect each other, so it's progesterone supports thyroid signaling, estrogen affects the thyroid binding proteins. So there's a lot of things that can be indirectly associated with thyroid. It's not just low function. There's those other hormones will also directly affect the thyroid at the cellular level.
So thyroid and metabolism. A lower thyroid, this is where it gets a little confusing, because we talk about TSH so much. And the truth is, when TSH is high, that is when clinically the active forms of thyroid are low.
Correct. Because you have to remember that your brain, specifically, the hypothalamus, pituitary, are trying to signal that thyroid to work. And it has to turn up the volume for the thyroid to hear it and listen, because it's not producing. And so that's certainly something I talk a lot of people that, okay, your radio's on, but your volume's not turned up. So it's a matter of trying to understand what happens there with that.
I think one thing that is very frequently associated with thyroid is weight. So I've heard so many people, and I myself was there actually, wanting to go get my thyroid checked because the things that I was doing aren't working the same as they used to. And change in body composition is definitely one of those things that gets you to the doctor to say, hey, can you check my thyroid? And they check your TSH and it's normal. And so end of story. But I would say that's probably the number one thing. But then as you learn a little bit more, as also someone who used to suffer with chronic constipation and depression, those also can be related to thyroid and low functioning thyroid.
Yeah. It's quite incredible that you just have to remember that your thyroid's basically like a lower thyroid function equates to kind of a slower metabolism.
Everything down.
Yeah, it just slows everything down. So you can kind of think of it that way. But I mean, it'll even affect your lipids. insulin sensitivity and lipids. You'll have lipids that are elevated potentially because you have low thyroid function.
So thyroid and brain and mood, I guess I just segued right into that.
There you go. But the low thyroid, I mean, that's, what it does to your brain and your mood. We talk about depression and anxiety.
And brain fog.
Literally.
Low motivation. And this is where another place where antidepressants have kind of come in.
Right.
To offset this kind of unknown cause.
Because you have a provider that is drawing your TSH and your T4. They look normal. Don't know, it's not your thyroid. You're just depressed. So maybe we need an antidepressant. Well, okay, there's other options. There's other things that we can do. So, if we can optimize this thyroid in our system, then that may help improve or resolve potentially even our system, our depression and anxiety. But the thyroid and the gut system, I mean, obviously, when we talk about autoimmunity, remember I talked to you about, the gut having all the immunity, the lymphoid tissue that's in the gut. So if there is issues or troubles with permeability in our intestinal tract, then that sets us up for more invasion and a more inflammatory response. And your body is going to want to try to fight that off. And that's where the autoimmunity comes in. Then you start having troubles also with nutrient absorption, iron, low iron. That's an issue. The TPO, the thyroperoxidase needs iron to be able to add an iodine back onto the thyroid molecule. And if you're low in iron, then you'll have trouble with that. That's the reason why individuals that maybe they choose a different alternate lifestyle, not eating meat, well, sometimes they got to support their iron that they need. But even vitamin D has a direct influence on, autoimmune diseases like the Hashimoto's.
Which vitamin D is something that is so commonly very low, if not actually deficient.
Yeah.
And we have patients that are literally outside for their job all year long, all day long, and still have a thyroid
deficiency.
Or a vitamin D deficiency.
Vitamin D deficiency, yes.
So it is one of those things that is really something that needs to be looked at. And that is another really funny thing that insurance companies, we had a patient whose insurance company wouldn't approve a vitamin D test unless they had a diagnosis of a vitamin D deficiency, which
how are you going to get that? They don't draw the labs.
Completely backwards.
Right. And I don't think there's not really there's very few, I'm sure there are exceptions, but there are very few patients that walk into this office that have normal or optimal vitamin D levels that are not being replaced. In other words, the only people that have optimal vitamin D levels are the ones that are replacing their vitamin D supplements. Mm-hmm. And that is across the board. That is a very broad general statement, but in general sense, it is true.
So as far as what are good things to look for when you're looking at thyroid?
TSH, free T4, free T3. Those are biggies.
Those are the foundation.
Right.
And yes, well, the other part of that foundation is a TPO and a T thyroglobulin.
That's the other antibodies that we draw too. Yeah. It's imperative to get those. Now, reverse T3, okay, yeah, that's affected by stress, but that's an inactive form of thyroid. That really gives you more of an input about how much stress you have in your system. If you're not able to tolerate stress or you have too much stress, then you're going to have a little more reverse T3. So that basically, it takes this iodine. I don't want to go in the woods, but it takes the iodine, takes it from one part of the ring and puts on another, and so that your cells don't recognize that free T3 then. That's why they call it reverse T3. Kind of interesting.
So those are foundational thyroid biomarkers that we would be looking for. And then we've also kind of talked about those nutrient things that we would look for. We do look at iron and ferritin on everybody. We look at vitamin D on everyone. We also look at several different inflammatory markers. If you find that thyroid is an issue, you could dig a little deeper and look at selenium and iodine too.
Right. Yeah, the body does a real tight regulation on iodine. And selenium, there's not very many places we get selenium. Brazil nuts are a great source there on that. Literally 1 or 2 of those a day is more than your adequate amount of selenium. So your body doesn't need a lot of it, but it does need it to make thyroid hormone. But I think it's really important to understand the fact that your TSH is just what your brain is perceiving of the level of thyroid hormone in your blood work. So what thyroid hormone is floating through your blood is signaling your brain, your TSH production. They have an interrelationship. It doesn't say anything specifically about how well your cells are seeing the thyroid hormone, or if it's working,
or if
there's problem at the receptor sites. So there's a difference. That's why people can have normal labs and still feel cold, tired, depressed, and fatigued.
Right. And the other piece of that is that your TSH is looking at the T4 level, which you can have a normal T4 level, free T4, but not have a normal or optimal free T3, which is the actual active part of
it's kind of crazy.
Thyroid hormone.
Yeah, it's kind of crazy. Your thyroid produces a hormone that is not active. It has to be converted. And it goes to the liver, a little bit in the thyroid, but it has to be converted to an active form of thyroid, which is so fascinating that it does that.
So that kind of leads into the different types of thyroid replacement.
Yeah.
Because typically, if someone has a diagnosis of hypothyroid, they will be treated with synthetic T4, levothyroxine. Synthroid is what people may know of that.
So yes, just to back up, sorry, the 2 main forms of thyroid replacement are you can think of as being synthetic and natural. So, and the synthetic is what we spoke of here, and what you spoke of.
Bioidentical.
Correct.
So that
Correct.
could
also fall under the natural category. Correct.
So one of the things that we've touched on a little bit already is that sometimes people don't make that conversion from T4 to T3. And T3 is the active part that's actually going to do the stuff.
Right. Create the expression in the cells. And every cell in your body has these receptors. Every one of them. Even the placenta will have thyroid receptors during pregnancy, which is kind of interesting, I thought.
So you've got your synthetic T4, that levothyroxine or Synthroid, and then you've got the synthetic T3, which is liothyronine, cytomel, I think is the other name for that. But that's another synthetic form of thyroid replacement, commercially available.
Right. And then the natural desiccated thyroid, the bioidentical thyroid, that's derived from pig thyroid. But the important part of that is it contains a mixed component of T4 and T3. And that's where patients will just feel better by having given them the active component of that thyroid that will make them feel more energetic, et cetera, and help improve the symptoms that they're having troubles with. But, that does require careful dosing. It's one of those things that if we have thyroid replacement on a patient, I want to see your TSH level go down. I want to see it below normal. That tells me that I have the adequate amount of thyroid in your system that is telling your brain that, okay, I've got a lot going on. I got plenty. I need to calm down. I don't need to stimulate the thyroid to work anymore. And that typically is where we'll start to see improvement in symptoms too. That's a very general, broad statement.
And this is where symptoms really do help in the treatment, because if you are feeling good and your T3, so say your T3 levels are improved, but not, some people need to be optimal. Well, if your symptoms are improved, then that's great.
Right.
That's where we need to be. And so often providers will look only at the lab values and say, oh, you look good because you're in the normal range. And
yeah, we brought your TSH down to where it should be normal now. Well, that doesn't mean the cells are working. That doesn't mean the cells are receiving that input, that signal input. So that's important to know that.
And one thing just to note is desiccated thyroid has been around for a really long time.
Yeah.
I mean, so long it's often talked about as dosing in grains, which is not even something that anything else is
Right.
dosed in. There isn't really a best replacement. Everybody is different and circumstances are different. So
Yeah.
you
We're
know,
all,
the
they're all
options are
snowflakes.
there.
We're all snowflakes. Exactly. So, everybody's receptors are different. There's different types of densities of receptors. So, and how a person's system works to those. So everybody's different. And you just have to remember that normal is not optimal. I mean, we preach that continuously, but just because you have normal lab values doesn't mean that that's where you need to be.
Right. And optimal is different for every person.
Correct. Symptoms make the difference. That's the difference. What you have to know, you have to treat person based upon their symptoms, not necessarily always about their lab values.
And it is very important because overtreating or undertreating can both cause harm.
Right.
So it's so important to stay in contact with your provider and let them know how your symptoms are, how you're feeling.
And, BHRT talks about how longevity depends on your metabolic and hormonal alignment. So that's an important thing to remember too. So takeaways, there's a lot of things that we went over, a lot of things we talked about, but you just have to understand that normal is not optimal. Everyone's different, and you have to really base treatment off symptoms.
And advocate for yourself. Keep asking. Digging deeper can sometimes be the answer. And even if it doesn't give you the answer, it says, okay, we can not have to look at this right now. We can move on to look at something else.
Right. And but thyroid health does require other things. We have to have the proper medication. We have to have the nutrient replenishment, stress management. Obviously, you got to take care of the stress. And metabolically speaking, we had to have a lifestyle changes to support that healthy thyroid function. So,
yeah, I mean, I think that.
But hopefully that cleared up a little bit of a little muddiness. But certainly just understand that not everything's related to your thyroid. Just because you're tired and have low motivation doesn't mean your thyroid's problematic. But it's certainly something that there's a lot of components, a lot of symptoms that really relate to low thyroid function. And it's not necessarily the point to try to diagnose somebody with hypothyroidism before you replenish their thyroid. So,
all right. Well, let us know if we missed anything. If you have any questions, feel free to send them our way. And we look forward to seeing you again next time.
Have a healthy day.